escape it. And the bottom line is that plastic goes everywhere. It enters the food web. It goes to all the different stages of the food web, to the point where at the end, you and I are the ultimate predators, right? So the question is, how much of this plastic do we eat? How much do we breathe? How much do we drink? And what's the impact, right? So obviously, we are not like whales. We are not like fish. We see what we eat. We are not going to swallow a plastic bag. We are not going to, swallow a confetti of plastic. So my research is on small microplastics. The small microplastics are the ones that are 100 micron and below. 100 micron is the size of one hair. So I'm looking at pieces of plastic that are smaller than one hair, all the way down to almost the nanometer scale. And those plastics can come from two different sources. They are called the primary microplastics, which are the ones that are made small to begin with. Those are the ones that you put on your skin every morning, in lotion, in mascara, in everything that you can use as cosmetics, including sunscreen. And then you have the secondary microplastics, the one that you are used to consider when you look at the ocean and plastic bags and water bottles just floating around. As they progress over time under UV, these large pieces of plastic will break down into smaller and smaller pieces until when they reach a size of below 100 micron, and they become what we call small microplastics. What's interesting about small microplastics is that you use them every day. You brush your teeth, you are generating hundreds and hundreds of pieces of microplastics. You put lotion on your hair, you use detergent, you use any kind of shampoo, it is everywhere. And so to address this topic, you have to look at the labels. You have to look at whether or not small microplastics, small microbeads, they are called, are found into your cosmetic products. Because otherwise, you put them in the morning, you wash your face at night, it goes in the water, it is too small to be stopped by the wastewater treatment plants. It goes in the ocean, then from the ocean it goes in the fish, the bigger fish, and then eventually you. But it might not go through the fish, because with wind, microplastics, small microplastics can go back into the air. In Ghana, we have done some research where we measure plastic in the air and we measure plastic in occurrence with rain. As you can see at the beginning there, and I'm sorry, I don't think the laser works on this. Big red, green dot somewhere. But if you have a short event of rain where you collect 16 mil of water, you have very high amount of plastic. That's called the first flush, meaning that there is so much plastic in the air that when it starts raining, all the plastic is brought down. And the longer it rains, the less plastic you have, because obviously you have already cleaned up the air. This is very important for public health purposes, because if you live in an environment where you use rainwater for drinking water, we are trying to tell people in Ghana, please do not drink the water for the first 20 minutes of the rain. Obviously, that changes if you have dryness between rain events. So if you have 1 or 2 or 3 days of dry weather between rain events, it doesn't really change the amount of plastic in the air, as you see at in the bottom here. But if you wait for a week, you will see that the number of plastic will increase into the rain, and that's definitely something we want to avoid. Oh, here you go. That's what I'm talking about here. All right, so that's after a week, you see that I have to shine where? Somewhere. Anyway, so you saw it. But Ghana is not the only place. We collected samples in Park City in the snow. And so, it's a great job to go collecting samples if you like to snowboard. And so you go to the highest peak, 9990, which is at about 10,000 feet. Only, triple, quadruple, fifth, black diamond. So almost no one goes there, right? Because otherwise you die. So, but you expect the plastics in the snow there to be low. You are there is really no one. It's pristine, it's just snow. We collected sample right after snowfall. And we compare that to other stations that are very crowded, including Park City, the city itself. And what we found is that there's actually no difference. There's the same amount of plastic, microplastic in all those areas. What's even more interesting is that at the very top, we find parts of plastic that we can identify as being rubber crumbs or being materials that are not related at all to any ski activity. So they come from somewhere else than just the snowboarding or the ski activity. And you can see here on the right, that these particles are real. You know, people are always like, well, you don't see them. No, we do scanning electron microscopy and we can identify them, as you can see there on the scanning electron microscopy. So plastic is in the water. In the US, a study from 10 years ago shows that about 95% of the water in the US contains microplastic. And whether you drink it from a glass water bottle, a plastic water bottle, or the water fountain for that matter, doesn't really matter, it's the same thing. So when the plastic is in the water, it can also sink. And as a marine biologist, we look at what's at the bottom of the ocean. And what's at the bottom of the ocean is mostly tire fragments, which I will not talk about today, but also textiles, right? And so textile is a huge source of microplastics. This is not my wardrobe, and hopefully it's not yours either. The problem we have with textile is the over-consumerism and the fact that fast fashion that makes textiles made of plastic is a big issue. I have a son, he's 17-year-old, and he's like, every week he can buy a t-shirt. And I'm like, hold on, you can also use my shirt, right? In the old days, we were doing that. We were passing clothes from generation to generation. That doesn't happen anymore. So the problem with the over-consumerism is that if you have t-shirts that you don't use, you donate them. Donate them to Goodwill. It's a great feeling to give away your waste. And waste becomes waste colonialism, meaning that Goodwill sends this to Ghana, to Kenya, to Indonesia, where people receive 15 million items every week. 40% of that cannot be used, goes in the landfill, is burned, is being carried through the lagoons and ends up on the beach. And sometimes you do not see the sand under those clothes. Every week, the foundation that we work with collects 30 tons of textiles. Okay, they're wet, that's heavy, but 30 tons of textiles every Friday. So that's a problem, because when you look at it in terms of microfiber, which is the long, elongated microplastics, on average, along the coast in California, you can have 1 to 5 particles per liter of microfibers. Here along La Jolla or Point Loma. It goes all the way up to 3,000 in these areas. So there is a lot to say about textile waste and how we can regulate that and how we should regulate that. If you're interested in this study, it just got published a couple of weeks ago. I'm happy to share the text with you. Now, textiles obviously is also involved into us wearing it and not wearing something that is dirty and smelly. So we wash our clothes, and we should. But every time you wash, you have to keep in mind that for every single item that you put in, about 2,000 microplastic particles are being released. 2,000. That's about 70,000 per load. And that's about, you can read the number, 12 something kilogram per year. That's a lot. And that's invisible. Most of the time, people are not even aware of it. Now, obviously, there's the same problem with when you do the dryer. In that case, you put that directly back into the air. Now, there are solutions for that, obviously. Companies have invented filters that stop 95% of the plastics. That's great. But then what do you do with the filter? Right? Only a few facilities can deal with that. If you want to look at what microfibers look like, they are microplastic that are elongated. They glow in the dark. That's how we identify them in my lab using a methodology that we call GlowTech. And that helps us quantify them. Now, just a little bit of what we do. we study the biology of microplastic, the biology of small microplastics. We know it's in the air, we know it's in the water, and so we follow the cycle of these particles. And obviously, you breathe them. Do we keep them in your lungs? You breathe 10,000 liters every day of air, even if you have 5 particles per liter, which is an average. Well, that's a lot of particles at the end of the day. When you sleep with your head on your pillow, which is probably made of synthetic material, how much plastic do you breathe? Does it stay into your lungs? If you see the little dots there with the arrows, all those are plastics that we were able to identify in 2 lung sections. But the lungs is something we are questioning. Well, once you have those plastics into your body, they circulate around, they go into your blood. Your liver is what is supposed to clean it. Do we see them in the liver? We actually do. And we actually are now studying the fatty liver disease, which is a disease where the liver accumulates a lot of fatty acids, which is common in the Native American population and the Latino population. 30% of the people have that. And so we are looking at that, and there is indeed more plastic in the liver of fatty disease patient because obviously plastics likes to be in an environment where it's hydrophobic. So at the end, to understand the biology of microplastics, you have to look at different pathways of accumulation through the body. Again, you breathe them, you drink them, you eat them. How do they enter your body? You know, through those different areas that are listed there, and how the different organs can be studied. We study all of these organs, including in Europe, here, and obviously in Africa. The reason why it's important is that we might be full of plastic, but we don't know how much. We don't know by which type of plastic, which organ. Can we take it out? Can we depurate that? Those are the questions that are important to me, because at the end, the problem is with you, but the solution is with you for generations to come. Because by the time we try to find the solution of taking the plastic out of our body, the impact will be on the future generation. Because the plastic has 500 years lifetime. Because the first plastic that was ever created in the 1950s is still around in very, very small pieces. And it will disappear only in 425 years from now. That's many generations. And yet we are not able as a society to cap the production of plastic. We are at 460 million tons. It's going to be growing up like that every year. So in the lab, we approach, and I think that this is the spirit that we are in here, we approach plastic and small microplastics from many different angles. We look at, obviously, what's in the ocean. I'm a marine biologist. We look at the organisms there. We look at the food. We look at human body. We try to look at solutions for, the washing machines. But we have to look also at the policy. We have to work with you. We have to work with foundations. We have to work with industry that they can bring solutions. That's why the small microplastic problem is a global problem that has to be cross-disciplinary. There are solutions already in place. We work on them. We work with companies that make alternative materials to plastic. You can buy clothes that are made of bamboo, that are made of lyocell, tencel, not only polyester. You can filter. You have to continue monitoring. All those are the positive statements that we have to bring to an audience. Otherwise, we need to have hope to move forward. Otherwise, we will not be able to find a solution. The process that I have in my lab is already growing, and I hope that I can here establish new collaboration. I work with companies like ChefWorks. They're interested. They are the ones who make all the attire for chefs that are cooking for you in the restaurants. They're interested to know how much plastic do they make that goes into your food that they don't know, that you don't know, right? Those are very important questions. Other companies like this are, the OR Foundation that we work in Ghana, and Axon J is an AI company, because now obviously you cannot do science without having at least AI somewhere, so that we can try to estimate where things are. So if you want to know more about what we do in my lab, this is a QR code. Please connect send an email, go on LinkedIn, get involved. I gave a TED Talk last year, which the link is there. I'll give another one in July this year. But please get involved, and I will take questions after the second talk. So thank you.
Yeah. Let me just stop and just back up really quickly. I think being here in this region, we're really fortunate to have UCSD and the many different areas that their research spans. And so appreciate Dr. DeHane for coming from UCSD Scripps. And then now we have Dr. Shira Abelis from UCSD Health in the School of Medicine. And so Dr. Shira Abelis is the board certified infectious disease specialist and serves as the medical director of sustainability at UCSD Health, supporting efforts to adapt practices to best promote health of patients and the planet. Dr. Abelis also serves as a medical program director of antimicrobial stewardship at UCSD Health and as an associate medical program director of infection prevention and clinical epidemiology. That's a mouthful. And there's more I can go on. And her research focuses on evaluating methods of curbing unnecessary antibiotic use in healthcare settings, as well as assessing the clinical impacts of various infection prevention interventions. And so without further ado, I'd like to turn it over to Dr. Abelis to talk about plastics and health impacts.
Hi, everyone. Thanks so much for the introduction. Thanks so much for having me. I do get to serve in this really unique role that's starting to become more common in healthcare settings where we have a medical director of sustainability to work on sustainability in healthcare. So I'm going to go over what we know from a medical perspective about plastics' impact on health, and then talk a little bit about what we're trying to do as a healthcare system and as healthcare in the United States to promote health, throughout all of our operations. So I can kind of gloss over all of this because Dimitri just did an amazing job going over in a very inspiring way the burden of plastics in the environment and in our bodies. And I also pulled from a medical literature, kind of a picture from 1955 of how amazing it was, when we first got plastics. They were versatile, lightweight, durable, easy to use. And so they were really celebrated. It really alleviated jobs in the household and so freed up a lot of time. And so that was really celebrated. And like a lot of things, the downside was ignored or not understood yet. And that's where we are today. Plastics are composed of a lot of different materials, including lots of chemicals that are known to be hazardous to our health. And then, of course, thousands that have not been assessed for their impact on our health just because it's impossible to keep up with the production. But the plastics are associated with things like flame retardants, UV stabilizers, phthalates, PFAS, all these things known to have harm to your health. And so this is from a amazing paper in the medical literature from 2023, where it's just, there's no question. We were just talking about microplastics, but there's a lot of evidence that plastics do a lot of harm to health. So there's no question that plastic workers, people who are there extracting oil and gas from the earth, coal mining, right? There's coal miner's lung. We know that. People are getting cancers, there's explosions, there's just trauma, and then, of course, emphysema. And then in production, there's a lot of associations of plastics and cancers in people who work closely with in plastic production, anything like hepatic angiomas, which are cancers of the liver. We're making connections here, leukemias, lymphomas. So all that's very well established. There's just no question. It just seemed to be, we didn't take it into our mindset. We just said, oh, that's a risk. It's not like, oh, there's something wrong with this. We shouldn't necessarily just accept that risk. And then in communities living close to production places or even fracking, There's associations with childhood lymphoma. And then in the users, right now, we're starting to understand more about kind of some of the endocrine impacts, the leaching of these chemicals when we drink our water bottles, our plastic water bottles, we're ingesting so many of these particles, and not just microplastics, but the plasticizers that have hormonal impacts on us and that contributing to obesity, infertility, things like that. So all those things are well established medical facts. And then what we're learning about now, what we really didn't know about was about these microplastics. And thank you to researchers who are describing these in the environment, how we're breathing them in, putting them on our skin. You know, now we're looking for it in our bodies and trying to understand the impact that has on our health. And so, as was already described, microplastics have pretty much been described in everything in our bodies. What I found really remarkable was it's in placentas, right? Placentas are there for less than 9 months. So it happens pretty quick. And then research showing that it's in breast milk. And so you can imagine that's even a more short-term lived. So it's kind of just speaking to this constant presence. And so I just want to tell you about kind of, I think was the main article that just was published a couple years ago from a study looking at plaques and associating it and looking for health outcomes associating with microplastics in plaques. Okay, so this was a big study looking at people who were going in for what's called a carotid endarterectomy. So they have a lot of plaque in their big carotids here. So it's a risk for stroke, right? Because if you have plaque here, it could go up to your brain. So if you have a lot of plaque here, the vascular surgeons can take out some of that plaque and decrease your risk for stroke. But what these researchers did is they said, okay, we're going to look for microplastics in these plaques. And they found, they enrolled a bunch of people and eventually had 257 people in the study. 150 of people's plaques, they were able to find microplastics or nanoplastics in the plaques. And the other 100 didn't have any microplastics. And then they followed them for years. And then this is just a picture showing that they looked for microplastics using multiple methods just to make sure they knew what they were looking at. And what they found was over time, over the months since they had their operation, the people who were found to have microplastics in their plaques were more likely to have heart attack, stroke, or death. And that's a clear trend. And so this was published in our, one of our most renowned journals, and was, they even followed it up and they looked for markers of inflammation to see why are these microplastics resulting, in this cohort having more strokes and cardiovascular events. And they saw increased inflammation. When you compare the group on the left, those are the patients who had microplastics. They have elevated all these different markers of inflammation compared to the other group that didn't have microplastics in their plaque. And I really think that opened up a lot of interest in the medical field. And so this is just an example of studies published in 2026. On the top left, it was a small study, but it's a start looking at people who had stroke versus people who didn't have stroke, and looking at microplastics circulating in their blood. And they're seeing increased rates of polyesterines and a couple of others in people who had stroke compared to healthy controls. And then, as you already heard, people are starting to do, hypothesize and think about, could this be related to neurologic disease, to liver disease? And then there's basic scientists too, looking and doing more kind of direct studies. And so I'm showing a study that was published this year where they were growing organs in tissue culture and having endometrial, so uterine cancer in this lab scenario. And then they introduced microplastics to some, and they didn't introduce microplastics to the other. And you could see the red line is showing advanced, more rapid, escalated tumor growth in the presence of microplastics, which is all just kind of hinting at our body, it causes a reaction, right? So there's more inflammation and there's measurable health outcomes. I'm just giving, we're still very early in understanding the association, but this is my area of interest. Microplastics and plastics have an association with microbes, right? Microbes latch on and grow and then can protect themselves from the environment or be exposed to all the other sludge going on there. And there's an association there with antimicrobial resistance that I'm particularly interested in. So this is just showing how it's this additional factor driving antimicrobial resistance that we really are only starting to pay attention to and understand. And so I have always been an environmentalist at heart. I went into medicine, and it was a long journey, but it's wonderful to recognize that there's a role in the medical field to try and do something about plastics in healthcare. And so there's this whole movement called sustainability. And the reason is we look at our own practices and we see how much we rely on plastic. And so this is just an overview. You know, plastics, you know, you'll see, I mean, they're amazing, right? They're low cost, easy to process. And once you use it, you don't have to worry about it being infected because, or infecting someone else, because you could just throw it away. So there's a lot of attractive features about it, which is why it's really taken over in healthcare. But now we're putting pauses on that. And just looking at the massive impact we have in healthcare with 3,500 tons per day being produced in healthcare settings of plastic. And you just think about it, we use things like our saline bags, which used to be, saline is, you know, people need fluids when they're in the hospital, and it used to be administered in glass, but now we use plastic. And it used to be that those plastic bags that contain the saline that we're giving to people who need it were made of PVC and plasticizers, and the plasticizers would undoubtedly leach into the medicines we were giving, but no one was paying attention to that. Now in California, thanks to policy, we've actually eliminated those more harmful IV bags. Luckily, they also were more affordable, so it was an easy change to make. But it's just thinking differently in healthcare and trying to walk the walk a little bit. And here's just an example. The ophthalmology has a great group trying to push sustainability. And you could see cataract surgery, you know, it's a small surgery, it lasts about 10 to 15 minutes, but it is high volume. There's a lot of people who need cataract surgery. So it is the #1 waste driver out of our surgeries that we do, even though it's maybe the shortest. On the left, you could see how much trash is made from one cataract surgery in the US, and you can compare it to 93 cataract operations in India. And these are published studies, the same infectious risk. So we have a lot to learn. We could do better, and we can decrease plastic. We have I'm just showing an anesthesiologist of ours who also is a pain physician. You know, they do procedures. And so he decided to do a waste audit and just look at what is all this waste that we're producing every day in our procedure suites. And so they just collected the trash every day and audited it and found that most of what we were throwing out was plastic, and most of it was packaging. Right? Doesn't it seem like that would be an easy thing to address? It wouldn't put any risk. There's no question about it. So it's just important to kind of view what are we doing and how can we do better? And then I'm just showing here something that I've been talking about for a while now and working on for a while, but you could see there was a waste audit at a hospital, a big hospital, MGH, in Boston a couple of years ago during the height of COVID. But you could see they just collected trash from 24 hours on a single 20-bed medical unit in their hospital. And you could see it there. That's one day on one medical unit. And most of it were these disposable gowns. Sorry, I should probably hurry up. And so,
Fine.
Okay. So we are trying to address this through sustainability in healthcare. And so UCSD and a lot of the UCs have sustainability as part of their mission. And we're trying to address multiple things, including plastics and health. So, you know, how do you do this in a health system? Sometimes you look for the easy stuff, right? Let's look at our food and look at our food packaging, right? Let's look at our furniture and avoid chemicals of concern. Let's make sure we're purchasing energy efficient products, but we're also trying to reduce our waste. In the US, it's around 29 pounds per patient day in a hospital. Our goal is to get to 20 pounds per day by 2030, and we're at 22.5 or thereabouts. So I'm just giving you an example of some of the work that we do. So you saw how much gowns contribute to our waste. We use over 900,000 of these disposable gowns every year in our health system. And I'll tell you, every single health system around San Diego is using disposable gowns. It's very common. Where I trained in medical school, we used launderable gowns. And launderable gowns, you know, you could say, oh, well, that's going to use more water, but there have been studies looking at it, and across the board, launderable gowns are better for the environment across their lifespan compared to disposable gowns. And so we've been working, I'm embarrassed to say for how long on this, but it's a very hard thing to do in the medical center. There's a lot of moving parts, a lot of job shifting, but this is a goal, and some of our sister UCs have already achieved it, and we're set on doing this. You know, it's been a long haul, a lot of progress, setback, progress, setback. You need to make it financially feasible in these times, but we're still working on it. And we're just, you know, just to give you some example, we're talking with our vendors, trying to say, we want reusable products. You know, take these, we never use these. You're giving these packages with these 3 items that we never use, take them out. Can you bring these items in a reusable container rather than this disposable blue wrap? And trying to also look at recycling of plastics, but in a non-toxic way. Of clean items, of course, and avoid low value care. That's a lot of what I do as a clinician in this space. So to sum up, you know, harm from plastics is well established, and we're just starting to unravel how microplastics are intertwined with health. They're definitely intertwined with our bodies. And I think healthcare, you know, should be a leader in this space because it's such a circular relationship. And I think, you know, reducing plastic consumption is a way to promote environmental and human health. So thank you very much for having me.
Again, I just want to say thank you to Dr. Abeles as well as Dr. Dehane, I think, on this really impactful presentation that they both just shared around microplastics in general, and then the impacts to health. And then microplastics, there's also the solid waste. There's the bags, there's the bottles, the cans, the bowls, as well as every other thing that we've seen is somehow turned itself into plastic. That is also part of this fund. So I just want to thank you all. And again, we are so fortunate to have UCSD represented here, the world-class institution that it is, but in the health, but also in the science side, really being able to provide a broad overview and an interdisciplinary view of microplastics and plastics and how they impact our lives on a day-to-day basis. We wish we had more time to give you more sectors because we'll be here all day, and I know you all are really excited about this, but we also want to talk to you about a really exciting opportunity right now, which is the Plastic Pollution Mitigation Fund. But before we begin, I'd also like to reintroduce my colleagues again and myself. I'm Maurice Lyles, Deputy Secretary for Intergovernmental Relations at the California Environmental Protection Agency, and then I'd like to turn it over to my colleague, Yvonne.
And hi again, everyone. Yvonne Shu, Deputy Secretary for Environmental Justice and Equity at CalEPA.
And hello, everyone. Thank you for being here. Marlene DeLo, Deputy Secretary for Public Policy.
And so we are the trio that are largely working on the Plastic Pollution Mitigation Fund. And so we're really excited that we're going to be able to get feedback from you on how best this fund can best serve this region as well. So I do also want to acknowledge there are 2 other agencies that are named in statute. They send their regrets they cannot be here, and they're California Natural Resources Agency, or 3, sorry. California Natural Resources Agency, the Strategic Growth Council, and the Department of Justice. So those are the other 3. There's a good amount of information. Oh, I gotta hit the slide. Is my slide up? Thank you. It's a good amount of information that we plan to present today. And this is just largely the beginning of this conversation that we're having. Toward the end of the presentation, we'll have a discussion to learn more from you about how you envision the Plastic Pollution Mitigation Fund addressing regional needs, interacting with the programs that you think it should benefit from, but how do we mitigate and address plastic in all of its forms that are impacting us in the region. For today's presentation, we'll first start by briefly introducing our agencies involved in designing this fund, an overview of the Senate Bill SB 54, which establishes the Plastic Pollution Mitigation Fund, basic information about the fund based on statute and what can and cannot be funded in very broad categories, as well as next steps. San Diego and Imperial counties are probably two of the most unique regions in the state of California. San Diego is the largest binational metropolis in the United States. And then you tether that next to Imperial Valley, which produces, I think, the largest amount of winter vegetables in the state of California across the nation as well. Also a dark sky region. So if you're ever a stargazer, it is a beautiful place to go out and look and seeing the desert bloom during the days as well. With opportunities, that come from being a binational region, though, there are also some regional challenges. The Tijuana River and the New River have been issues and crises related to transboundary flows, flows of pollution, waste, and air quality impacting local communities. Flows from 120 miles from Tijuana through the San Diego County into the Pacific, carrying sewage, chemicals, solid waste, plastic debris across our border on a day-to-day basis. Could this fund address and stop all of that? Probably not. But can this fund help address some of the symptoms that are related to this? Possibly and absolutely. And that is what we're here to have a discussion about. But I don't want to limit this discussion solely to that, because as you've seen, both the doctors discuss, plastic is everywhere. Right? It is not only in our beaches, it's not only in our rivers, but it is also in how we're consuming and how we're interacting with it on a day-to-day basis, even in the healthcare industry, as Dr. Abelus just shared. The beaches have been closed over 1,600 days. That's over 4.5 years. Imperial Beach communities as well. 70% of their residents, or Imperial Beach, they don't have trust of their current water systems as well. So there's some real meaningful impacts that are happening as a result of this. That distrust of the tap water, with many people relying on bottled water, which contains up to 20 times more microplastics than on tap as well. The New River originates from Mexicali and flows through Calexico and the Imperial Valley, carrying industrial waste, sewage, agricultural runoff, plastic debris. Very similar parallels to what is experiencing here in San Diego County is also being experienced in the Imperial Valley region. So this isn't just an isolated incident. This is a systemic incident as well. And it runs through California's most economically distressed communities. Imperial Valley has some of the highest asthma rates, poverty rates in the state. Communities along the New River Corridor, Calexico, Brawley, El Centro, have disproportionately high CalEnviro scores. And those are scores that look at environmental impacts, health, and the economy, and then forms a designation based on that. And you should check out our CalEnviro scores as well. And, there's disproportionate burden of environmental pollution and being highly vulnerable to its health effects as well. Like the Tijuana River, the New River is a transboundary problem that requires both federal action and local mitigation. We're interested in learning from you how you think these funds could be invested to help address some of these issues. That being said, I don't want to limit, like I said, this conversation solely to border conversations. While I think it's important and we will have those conversations, I think it's important for us to also think about the broader implications of plastic and how we're interacting with it on a day-to-day basis too. So we'll now move on to agency introductions. I'll turn it over to Yvonne. Thank you.
As Maurice said earlier, there are 4 agencies that are charged with administering the Plastic Pollution Mitigation Fund under SB 54, and I'll introduce a little bit of what each of them does. CalEPA, which is the agency that Marlene, I, and Maurice are part of. We are a cabinet-level agency that oversees environmental protection by coordinating various boards, departments, and office to enforce laws, protect public health, and promote sustainable practices for air, water, soil, pesticides, and waste management. Our departments are grounded in rigorous science, using research to shape the state's environmental laws and establish the scientific foundation for effective regulation. CalEPA helps to fight climate change with integrated programs to reduce greenhouse gas emissions, while also helping California reduce waste and transition from a disposable to a fully circular economy. Our agency is uniquely positioned to integrate climate, health, waste, and equity policy to prevent and mitigate plastic pollution, as well as improve public awareness on the impacts of plastic on human health and the environment. For example, one of our offices, the Office of Environmental Health Hazard Assessment, has been studying how microplastics affect people and the marine environment. The office is actively involved in assessing the effects of microplastics found in drinking and bottled water on people's health. The California Water Boards, also under our agency, have scientifically defined microplastics in drinking water, setting initial standards for testing and reporting, and required monitoring and controls for major known sources of microplastics. The second agency, the California Natural Resources Agency, or CNRA, is comprised of over 26 departments, conservancies, and commissions that include the California Ocean Protection Council, the Department of Fish and Wildlife, and the California Coastal Commission. Many others also under this agency oversee state-managed projects and restoration and issue grants for local communities. The key priorities under CNRA include ensuring safe and accessible outdoors for all, protecting biodiversity, and building resilience to climate change. The agency is also committed to strengthening tribal partnerships, empowering local stewardship, and making grants accessible for all through technical assistance and coordinating across agencies to amplify the impact of local projects. Third, the California Strategic Growth Council, or SGC, is a 10-member council comprised of 7 state cabinet agencies and 3 publicly appointed members. The council is charged with coordinating and working collaboratively with public agencies, communities, and partners to support the planning and development of sustainable communities, which strengthen the economy, increasing economic prosperity, ensure social equity, and enhance environmental stewardship. This work I'll go to the next one. Finally, we have the California Department of Justice, which is led by the Attorney General, or the AG, who is currently Rob Bonta. The AG is the state's top lawyer and enforcement official.
We wanted to share a little bit about how plastics impact our communities in California and our environment. I'll try not to repeat too much of what our amazing experts here today shared, but I do want to provide you all with a framework that we're using to, as we're thinking through how will we design the Plastic Pollution Mitigation Fund and roll it out. And we're leaning quite a bit on research that was done by the UCLA Luskin Center for Innovation. And they have been studying the environmental justice implications for plastic pollution and the pollution burdens that many of our communities in California face. And so they have this useful framework that helps us understand the implications of plastic-related exposures. So plastics don't just appear on a store on a shelf or in our trash. They have a long journey in how they get to us. And it starts with extraction, crude oil and natural gas, and moves through refining and manufacturing those plastics, and they end up in our landfills. And what you see here, the extraction, refining, manufacturing, these are what researchers call site-based exposures. And at each of these stages, upstream, midstream, and downstream, communities living near these facilities can face real health and environmental risks. And we know that distressed communities are far more likely to be at high risk of site-based exposures, and that proximity has been shown to be linked to various health conditions through what is a plastic life cycle. And so UCLA's report is organized. They've organized plastic health risk in 3 pathways. So site-based exposures, which I sort of just went through, the extraction sites, the refineries, dietary exposures, so accidentally ingesting microplastics from food that's wrapped in plastic or drinking water from plastic bottles, and consumer goods exposures. What some of the researchers mentioned earlier, we're in contact with them through cosmetics, our clothing, and other ways that they may penetrate our skin. Most common so for example, BPA is one of the most common chemical added to plastics. It is estimated that this chemical is responsible for or some of these more hazardous chemicals that are added to plastics are responsible for $920 billion in healthcare cost. As Maurice mentioned, bottled waters can lead to more intake in microplastics than tap water. And many chemicals are associated with plastics in consumer goods are known to mutate genes, cause cancer, and human hormones. Next slide, please. Plastics as others have mentioned, they're everywhere. They're difficult to avoid. They're in our food, they're in our grocery stores, restaurants. And our ingestion risk only increases when we heat those plastics. So when you're, microwaving your food in plastic, those plastics are shedding microplastics that then you may be ingesting. I think the next slide. So every community is impacted, but the impacts are not evenly distributed. Low-income communities and communities of color carry a disproportionate share of plastic-related health impacts. These communities see higher use of consumer goods with toxic chemicals. They're more likely to live near plastic facilities, and they are more reliant on packaged foods and bottled water, which leads to higher overall exposure. This results in more observed adverse health impacts, including more low birth weights in infants and more asthma-related emergency department visits. I think one of our scientists had a very similar a graphic here, but what we are trying to show is that, again, microplastics are not just within us in our ecosystem. They come from larger plastics that become microplastics, or these are plastics that are intentionally made small, and they enter in our environment through our streets, highways, mismanaged waste, flakes from artificial turf, tires, clothing, plastics in agriculture, discarded fishing gear, dust, and they're transported through stormwater runoffs, our rivers, wastewater treatment plants, wind, and circulated through ocean currents. And they, sink in our snowpacks, our sediment, our soils, and we're all ingesting some of those plastics.
Yeah, and I think what largely Marlene and Yvonne and myself and the doctors just recently mentioned that plastic is more than just a behavioral problem. This is a systemic problem. And so this just goes beyond individual behavior. There's like mass consumption and mass production that is also needs to be addressed. So we're going to talk about some of the efforts that the state of California is underway with plastics and how this through conversations with you all, we hope to supplement some of that work as well. So California has a number of initiatives across its agencies and departments to tackle plastics-related challenges. No single program does it all, and each agency is currently acting under its corresponding authorities and expertise. Efforts under plastic production include CalRecycle's SB 54, which was the bill that created the Plastic Pollution Mitigation Fund that regulations will reduce single-use plastics. OEHA, or as it's also known as the Office of Environmental Health Hazard Assessment, has conducted research on air quality in communities exposed to oil and gas extraction and refineries. Efforts are underway under the use of the exposure in plastics include DTSC, which has proposed putting microplastics on its watch list of harmful chemicals. This is the first step towards understanding how microplastics could be regulated and how we, the state, could require companies to find safer alternatives as well. OEHA, again, also has set safety limits for some chemicals that are associated with plastics. Efforts under waste and disposal include CalRecycle's program that supports the proper disposal and repurpose of certain certain plastic materials. And the Water Board, the California State Water Board, also focused around regulation of industrial stormwater discharge, includes controls to limit plastic pellets from reaching the ocean and waterways. Efforts under remediation include the Water Board's methodology for testing for microplastics in drinking water, the OPC, which is the Ocean Protections Council Ocean Litter Strategy, and data from the Coastal Commission's coastal cleanups has been critical to informing policy on plastics across the state. The state's work on plastic is also supporting cross-cutting themes, environment and ecosystems, and public health and science. Under environment and ecosystems, OPC is publishing the nation's first statewide microplastic strategy and plastics monitoring framework. California Department of Fish and Wildlife, or CDFW, as we refer to. We love acronyms here, so I'll just say that. CDFW works with partners to remove abandoned fishing gear and source of plastic pollution, which is a source of plastic pollution from beaches and coastal waters before they harm marine life. And the water boards, again, are leading efforts to standardize monitoring in surface water and sediments. Under health and science, OEHA, the Office of Environmental Health Hazard Assessment, so another acronym we love to say, conducted assessments of chemicals associated with plastics like PFAS. And CDPH, which is the California Department of Public Health, addresses cigarette butts, which are primary source of microplastics in the bay, estuaries, and the ocean. And one fun fact, or not so fun fact, and we were having a conversation with Coastkeeper prior to this, and you guys all remember when they would do the beach cleanup, cigarette butts were the #1 item being picked up at the beaches. That is no longer the #1 item being picked up on the beaches. So anybody have a guess on what that is? That's right. It is plastic. Plastic is the #1 item that is now being picked up on our beaches. And so that is just over the last few years, that number has the cigarette butts. And hopefully people are smoking less. But I think it's the proliferation and expansion of plastic use among everybody. Oh, did I skip something?
Plastic strategy.
I don't have that on this.
So I can do that.
Okay, thank you.
Go back a slide.
Yep.
And as we just want to give you a little bit of information on what Maurice mentioned, which was the first statewide microplastic strategy that the Ocean Protection Council has drafted with other state government entities. And so all the efforts that we mentioned are outlined in this strategy, and it's mainly around taking key actions to immediately curb microplastic pollution. The strategy also outlines research that is grounded in monitoring to help the state understand where microplastics is concentrated and how the state may best allocate resources to address and intervene with this kind of pollution. I think we can move on to the overview, right?
Okay.
Yeah, since looking on time.
Overview.
Yeah, so just really quickly, I want to give you an overview of the law that establishes the Plastic Pollution Mitigation Fund, so that folks understand kind of the full effort here from the state. So SB 54 has a name, Plastic Pollution Prevention and Packaging Producer Responsibility Act. Not only do we like acronyms, but we like mouthful names. And it's California's landmark packaging law that goes further than any other state in cutting single-use plastic at the source and represents a giant step toward a more circular economy. So SB 54, what it does is it shifts the responsibility of single-use plastic disposal from the public, our communities, and onto the companies that manufacture and sell those products. So by 2032, these producers of single-use plastic, they must cut the amount of plastic they produce by 25%. They have to ensure that 65% of remaining plastic is recycled, and all of it has to be 100% recyclable and compostable. And how will these goals be achieved? So SB 54 establishes a extended producer responsibility program, so or for short EPR program. These are programs that exist across the world, and we need these programs because we're generating more waste than ever before, and recyclable waste is ending up in landfills. Sorry, and as Maurice mentioned, it's not an individual problem or individual behavioral problem only. It's a systemic problem as well. And so single-use plastics and packaging have become increasingly complex, and frankly, our recycling infrastructure isn't keeping up. And so right now, the burden of dealing with all that plastic falls on local governments and ultimately taxpayers. That's the problem that these EPR programs are designed to solve. When producers are financially on the hook for managing the plastic waste they create, they have incentives to innovate by designing products that are easier to recycle, reuse, or we reduce the use of plastic in the first place and find alternative materials. So an EPR program can build more efficient recycling infrastructure, create jobs, reduce reliance on landfills, and help conserve natural resources by keeping materials in circulation. This is the foundation of a circular economy that prioritizes sustainability over disposal. So a typical EPR program involves the producers that are responsible for managing the plastic they produce and they put into the marketplace, and they pay fees to what is a producer responsibility organization. And this organization implements the EPR program, they collect the fees, they fund waste management and recycling systems that work towards those goals I mentioned of increasing recycling rates and collecting. They also collect data and reports that help these producers meet those targets that are in SB 54. So then there's the state agency, in this case for SB 54, CalRecycle, who oversees the program. And CalRecycle, as Yvonne mentioned, is housed within CalEPA. And you can learn more about SB 54 and activities that are going on for CalRecycle's website. But currently, the regulations for this law passed. Producers are enrolling into the producer responsibility, the EPR program, I'm sorry. The law also requires that CalRecycle has an advisory board. They meet on a monthly basis. You can follow those meetings as well if you go on our CalRecycle or CalEPA's website and find they're usually live streamed. And we have a needs assessment report, and so we're moving forward with implementing this law.
So now I'm going to go over the Plastic Pollution Mitigation Fund. So we talked about a lot of the issues that that plastic are impacting our lives on a day-to-day basis as people and the environment. And now we're, with this fund, there's some solutions that can be had. So we're going to discuss this fund a little bit, and we welcome your thoughts following this presentation as well. So this is what brings us here today. Starting in July 1 of 2027, the plastic producers will have to pay the state of California $500 million a year into the Plastic Pollution Mitigation Fund for over 10 years. So that's $500 million a year per year for the next 10 years to the total of $5 billion. The purpose of this fund is to mitigate the impacts of plastic pollution on communities, tribes, the environment as well, address current and historic environmental concerns as they relate to plastic, and protect the public health of communities, tribes, people, the environment disproportionately impacted by plastic pollution. The funds will be available upon appropriation by the legislature. 60% of those funds are for mitigating historic and current environmental justice and public health impacts of plastic pollution on communities, especially those plastic burdened communities. And 40% of those funds are dedicated to restoring and protecting the natural environment. For the 60% of those funds intended for communities, here is the statute here, as we mentioned, it is to reduce the historic and current environmental justice and public health impacts, including to mitigate the historic and current impacts of plastics on disadvantaged or low-income communities or rural areas. And disadvantaged communities for folks is actually a very specific term, and there's a designation associated with that. So I just wanted to share that. We also mentioned the 4 entities who are named in statute to administer these funds: CalEPA, CNRA, SGC, and DOJ. For the 40% of the funds intended for mitigating environmental impacts, the statute states that 42064J is to monitor and reduce environmental impacts of plastics on terrestrial, aquatic, and marine life and human health, including to restore, recover, and protect the natural environment. At least 50% of those dollars shall provide benefits to residents living in disadvantaged communities, low-income communities, or rural areas. And those funds may be used to support grants for tribes, non-governmental organizations, community-based organizations, land trusts, and local jurisdictions. And here are the government entities named within statute for that 40% as well. So what could be funded?
Yeah, as Maurice mentioned, it's a large sum of money, $500 million starting July 2027 upon legislative appropriation, upon legislative approval. And we want to talk a little bit about, what we're doing to design the fund, and also what are the things that are contemplated by the Plastic Pollution Mitigation Fund. As we mentioned earlier, this is the very start of a conversation that we're trying to have with California communities, different jurisdictions, as we're trying to design this fund. And we're going to present some information that offers pretty broad categories of possibilities to the program design. Those are meant to spark ideas and also to invite your input. Your direct feedback will shape how the fund is going to be designed, as well as an investment plan that we will be putting forward and presenting to the legislature. And we'll talk about that a little more later. This slide features some of the principles that we're trying to use to guide us as we work through the process, because as Maurice mentioned, a significant portion of the funding is designed to address the plastic pollution in historically burdened communities, particularly by plastic pollution. We want to make sure that the fund design centers those communities' input. We want to ensure that there's meaningful community engagement to invite that input. We want to prioritize those community-led solutions and projects. We want to ensure that there are meaningful benefits from this fund to tribes, environmental justice groups, environmental justice communities, disadvantaged low-income and rural communities that have been identified by the fund to be prioritized. And we want to make sure to deliver environmental health and economic benefits to those communities. So to start envisioning the fund, we're casting a pretty wide net across broad categories across the life cycle of the plastics, which, as Marlene mentioned, it goes from fossil fuel extraction to waste management and plastic degradation that creates microplastics. So The fund could be used, for example, for more outreach and education for the general purpose of increasing community understanding of the environmental and public health impacts of plastics across their full life cycle, and to influence public behavior with the use of plastics. As many of us heard here today, there's just so much that we don't know. I learned so much from the presentations of our experts today. And so it's very important for such outreach and education to happen for the effects of plastics to be realized. Efforts under this category could focus on the harms of plastic pollution and actions that can be taken to reduce the use or the exposure to this pollution. Another category of funding includes research and monitoring. We know from our scientists and colleagues in academia that there is a lot we don't know about effectively mitigating the impact of plastic pollution. We don't have a good sense of the levels of plastic-related pollutants in our waterways, in our soil, air, other relevant data across the state to fully assess the health and human exposure at the community level. Public health and exposure reduction. We want potentially programs and activities to reduce plastic-related health risks. An example, for example, is protective measures or advisories that are related to subsistence fishing, gathering, or traditional agricultural practices. Community-led pollution prevention. This could be community-designed initiatives to support reduction in plastic use. And this is important because the communities that experience plastic pollution burdens know their communities best. They know where the pollution sources are, and we want to make sure that they are equipped with the capacity and resources to address those that plastic harm themselves. Removal, restoration, and remediation. A fundamental purpose of the fund is to address legacy and ongoing plastic contamination. Activities within this category can include habitat restoration in plastic impacted area, nature-based solutions that reduce plastic exposure or debris, or microplastic mitigation strategies. And we want to emphasize that plastic removal or cleanup projects should be part of a broader mitigation efforts that reduce ongoing environmental and community impacts. Public infrastructure. This could look like filtration systems to protect groundwater for disadvantaged communities, or green infrastructure to effectively intervene with microplastics in stormwater. The purpose should be to protect communities from the environmental impacts of plastics. And finally, technical assistance and capacity building. This would include support to communities for grant writing, project development, staff capacity, among other activities, making sure, again, the part about ensuring that the communities who are burdened with plastic pollution have the capacity and resources to fund their own efforts, so that we can ensure equitable access to this fund. Very quick about what cannot be funded. Generally, the initiatives or activities that are the responsibility of SB 54 producers or producer responsibility organization, some of the activities that Marlene had outlined in some previous slides regarding extended producer responsibility, those are generally activities that we want to carve out of the Plastic Pollution Mitigation Fund so that we could dedicate Plastic Pollution Mitigation Fund to mitigating the harms and the historical health effects. The efforts that cannot be funded could include source reduction efforts, program operations, research and development of new packaging, waste management and recycling infrastructure, and infrastructure that's needed to achieve reusability and recycling rates.
Thank you. And here's a general timeline of our engagement strategy as presented on this slide. We intend to coordinate closely with community advocates such as yourselves as we develop our outreach and engagement strategy. Starting this spring and all the way throughout the fall, we'll host a variety of community events similar to this, in person, hybrid, and online. Later in the year, we plan to release a draft of the Plastic Pollution Mitigations Fund's investment plan, and that'll be based on the input that we are getting today, and as well as the program guidelines. The investment plan will serve as a roadmap that tells partners where the money is going, why, who benefits, and how success will be measured. The plan is subject to approval by the legislature as well. Subsequently, our state agencies, departments will engage with communities on the specific funding opportunities they are planning on implementing as well. In summer 2027, the funding will begin to become available as well. As we mentioned, that July 1st date, we anticipate the budget to be signed and us having access to those dollars beginning July 1. Finally, we plan to engage with communities and update the investment plan on a regular basis to ensure that the fund continues to meet community needs. And so our hope and goal is to evolve as communities are engaging this fund, they're seeing funds, maybe we're identifying where those gaps lie and involve what this funding can do as we continue to move forward. So we want to hear from you. This is the link to our website. Also on the website, there is a survey. So you may not have all the answers today or even things to say, or you may be a bit of an introvert. Some folks are. And you're just like, hey, I don't want to put this out publicly. You can go on there. There's a survey on there and you can just write in what your concerns are or how this fund can benefit, I think, your program, infrastructure-wise, research, outreach, some of those 7 pillars as well. And I will say we're not married to the 7 pillars as well. Is there an 8th? Let us know. I think we are open to learning, and that is why we are engaging you all on this particular idea. Email us directly, sign up for engagement workshops. I think these conversations will continue to evolve as we have UCSD here with us today. The next time we will have other leaders in this plastic space that will have a more interdisciplinary approach again. Engagements like this and the survey is the best way to get on record with your input as we learn more from you while we're moving through this process as well. So let this be a two-way street. This doesn't have to be the only engagement. Surveys and then emailing us directly are also other ways. So thank you. And I think for the remainder of this time, I'd love to open this up for discussion. We have somebody with a mic, run the mic back around here. Anybody? Yeah, and then we'll begin. If we do have a lot of people online as well. If just raise your hand if you have a thought, if you have an idea of how the funds could be leveraged. We'd love to do that. We'll go with in-house first, and then we'll go online with questions. If you can state your name and organization. If that one's not working, Katrina, can you pass this mic over here? Or as I mentioned, tech, the greatest gift and also our biggest challenge. There you go.
Thank you. Hi, Maurice. It's good to see you. I feel like I should stand up. Is that okay?
Please.
First of all, thank you. This is exciting to see. And of course, many of us are anxiously awaiting a year or whatever to pass so we can get to work on some of this. Welcome to the San Diego River watershed. That's where you are right now. That's my life for 25 years. Every day, pretty much, I've been dedicated to this one watershed. Our organization removes about 250,000 pounds of trash from the San Diego River by volunteers, community members each and every year. About 1 million pounds of trash washes into the watershed each and every year. And so we're looking for help, quite frankly. The other thing I would mention, just listening to the remarks, and I really enjoyed the presentations, I'm so happy to have people like you in San Diego, is don't forget the wildlife. In presentations, the wildlife is an important part of this. It's an important part of what was approved. We do want to make sure that the quality of life for wildlife is not forgotten in this as well. I think about 1/4 of the fish samples that were taken in rivers in San Diego had plastic identified in them. And so it's something we definitely want to work on, and I look forward to continuing conversations.
Thank you for that. And wildlife is named within statute as well, and marine life. Back there.
Wow, I get two microphones. Hello, everyone. Thank you for that presentation, doctors. That was so informative and it wasn't depressing at all. So you really good job at delivering that information that we all know. Hello, Maurice. And June, thanks for putting this together. So as I was thinking about the issue of where we are in the TGRV area, as we know, there's loads of plastic that's coming across the border. Fortunately, I don't know if Oscar's here. He runs the trash booms. Yes,
We have a
there they are.
representative from
Look at these people.
RCAC.
I'm not even going to even sing your praises because you should do it yourself. You're doing God's work. Literally sequestering 60 to 70% of the trash that's there is plastics. So we know that that's that solid waste that we've been talking about. But we also know that there's a ton of microplastics that are flowing through the water. So I'm on behalf of Supervisor Gary, sorry, I should have said that from the beginning. She's been working on the Tijuana River Valley sewage crisis for quite some time. And as we're starting to see these large solid waste particles break down into the microplastics, one of the things I have as a concern as her policy expert is these microplastics are then, coagulating, for lack of a better word, the toxins that are coming across from the industrial waste, the sewage itself, the DDT, the other parts that are there. They're kind of supercharged poop particles with plastic on them. And so one thing that we are looking at doing at the county is potentially doing river diversion on the US side. So that would be capturing the flows on the US side by IBWC and then diverting it to a treatment plant. It would have to be tertiary in this case, because as you mentioned, doctor, the microplastics can often go through some wastewater facilities. So, would that be something that this could go towards A? B, I actually have one of those filters in my washer to get out the microplastics. And so is there something that could also be in conjunction to like a large filter for a wastewater facility that would be able to capture those nano and microplastics? So I guess it's kind of a twofold question right there. And if you don't have answers now, that's fine. Just wanted to kind of plant that in there because we do know that there's the solid waste and then there's the microplastics that are now garnering all these other nasty chemicals around them, and river diversion would be a great solution. So thank you again for today. Appreciate it.
Thank you, Stephanie. And thank you to the supervisor for her leadership and Dr. He's going to respond really quickly.
Okay.
One moment.
Sorry. Thank you for your suggestions and the work that you do with the Tijuana River estuary. In terms of the large-scale filtration, only the reverse osmosis is a good solution, which, as you know, it's very costly a process. It's definitely not the route that we will go after. We are currently testing in Ghana a nature-based solution, which is using artificial soil marshes. And so if you let nature do its best, meaning that water will trickle slowly through different plants can actually stop the small particles, blend them with mucus and other things like this, and just sink them. And then it's a matter of trying to collect that and dispose of that as a hazardous material, or treat it with pyrolysis, which is the only way we can destroy plastic without making airborne microplastics. So these are options that we can work together maybe within this opportunity. If there is an opportunity to develop a nature-based solution. So that's, we have to think of the human mindset likes to see something built today with the answer tomorrow. Nature-based solution is it's all about time. It takes a long time for water to trickle and for particles to be captured, but over time it can be much more effective and much cheaper, obviously. Thank you.
Great, thank you. My name is Philip Musigas. I'm the executive director of San Diego Coastkeeper.
One second. I also wanted to talk to Stephanie's question around the river diversion. So the answer is possibly if there's a plastic nexus to that, right? If there has to be the plastic nexus. So I think creatively around that, and there's some possibilities around that too. So I just wanted to say that. And sorry, Phil.
That's okay, thanks. So I'm here on behalf of San Diego Coastkeeper. I just had kind of a quick comment and a couple of questions regarding the funding criteria. So we do have a lot of volunteer-based, volunteer-trained water quality monitoring, actually now in 6 areas in San Diego County, including the Tijuana River. We also have a really great binational resilience initiative project. We're partnering with the Tijuana Waterkeeper organization to do cross-border kind of outreach and engagement on the Tijuana River border crisis. And we also have a One Coastal Community website where we share research information, also an interactive water quality map shows our water quality results, data results in the Tijuana River, as well as Tijuana Waterkeepers data results along Playas de Tijuana, along the coast. So the questions relate to one, I guess, from my perspective, I think it sounds like it may be possible for us to integrate microplastics monitoring into our surface water quality monitoring program, potentially. Wondering if that is fundable. And then also, since we're working very closely with an organization across the border in Tijuana, if we're doing outreach and engagement with border communities that's based in the US, is that, if some of that is also reaching citizens of Tijuana, is that fundable, or does that have to be kind of screened out? I'm just wondering how that, we're in a border region where we're trying to work across the border to address solutions. So just interested in how that might play out. Thank you.
I wanted to say that within, so there are a lot of questions about what can be funded, and frankly, we're taking those as like suggestions and needs, community needs, and collecting this information and, going back to Sacramento and thinking about, okay, how do we best use this fund based on the community needs we've gathered? And so, you're not going to hear maybe necessarily a yes or no from us today, but we're certainly taking note, and we understand these as important community needs. But in your question, I feel like there was a little bit of an implication, maybe understood, that you have to be working on microplastics. It's not a fund just about microplastics. It's about solving your community challenge on plastics, and that may include microplastics. Think about, how is plastics really affecting your community, and particularly those communities that as we mentioned, disadvantaged, low income, and rural as well, that are included in statute.
Yeah, and I think Stephanie brought up earlier the state-funded trash boom that's capturing 60%, 60+% is solid waste plastic, right? And that's not even capturing the microplastics that are in there. So, I mean, there are could be potentially some opportunities. I think for us, this listening session is for us to think, hear the creativity that you all will bring, the uses that you feel that the fund could impact, and then try to take that and come back with something that's presentable in our investment plan as well.
And the second part of your question had to do with whether cross-border communities could also potentially benefit from this fund. And it sounds like in this case, if the effort that you're putting in is about outreach to your, like, currently within border communities, but that outreach reaches cross-border communities, there's nothing in the statutory language that carves out those cross-border communities. And, one can see a benefit in, like, working together across the border that would eventually address plastic pollution mitigation across the board within California too.
Yeah, and there's been some history of the state funding projects that do benefit California that have binational implications as well. So there have been like a waste tire and trash collection that has been funded across the state of California that has intercepted debris, and actually it's proactive because it's actually stopping it before it's even coming into the state. So there's a precedent for that.
Well, hi, my name is Faye Crevachet. A lot of people know me in the phone. So I work with Costa Salvaje, Wild Coast, in the border. And I'm glad, you basically answered. I was going to do like a follow-up about working in both sides of the border, but kind of it is a necessary part of solving this problem because it is two countries, one ecosystem. And a lot of the problem starts in Mexico and comes down through just gravity. And we've been, again, too preoccupied with the tsunami of plastics and waste tires that come down into the Tijuana River and go into the ocean, to even think about microplastics. It's interesting, but like, oh, well, I don't even want to think about the microplastics. If we have all these amounts of plastic, we have 2 trash booms in Tijuana, and we have stopped 300,000 pounds of plastic. We can do many more. Just resources are never what we want. And we serve the communities who are being directly affected, disease proven, because of the plastics and the toxicity of the water that leaches into the water. So I'm glad to hear that it is going to be binational, and here we are ready to work. Thank you.
Hello, my name is Yamilet Carrillo. I work at San Diego Foundation, and my boss just left, but I think you already met him. San Diego Foundation has the Binational Resilience Initiative that Coastkeeper and Tijuana Waterkeepers have been working in one of the projects. And I just want to share that San Diego Foundation, through this just one binational project that we have been supporting more than 55 binational partnerships working on different environmental issues. But along those binational projects in these 3 years, we have funded at least 7 that deal with waste across the border and plastics. So if there's any way that we can leverage our funding that we have deployed in the region, every year we deploy around $650 to $1 million in focus specifically on the coastal areas and the Tijuana River watershed that we share across borders, and we fund binational projects. So if there are some projects happening on the US side that can also partner with nonprofits on the Mexican side, or studies or researches, we would love to talk about more about how can we leverage our combined funding, because every year we have board allocations that we can leverage together. No, so thank you very much.
Yeah, thank you for that.
Hi there, my name's Courtney Baltiski, and I'm with the YMCA of San Diego County and also help convene the Tijuana River Coalition. I really want to applaud the spirit of mitigating these environmental disasters with microplastics for future generations. So that led me to think, is it possible to carve out specific projects or funding allocations for children and youth specifically? One of the ideas that we have been doing deep research on is bringing RX Kids to San Diego and the border region. This is the research-driven intervention that Dr. Mona has implemented in Flint, Michigan, and now across the state of Michigan. This is a child allowance, which is a targeted life course investment. It's specific on pregnancy, infancy, and childhood periods when resources matter most for brain development, health, and long-term outcomes. The intent is not to replace work or provide a general income, but to make sure children get a healthy start in life, especially in communities where environmental injustice, including those impacted by microplastics, may have an adverse experience on the brain development so early in life. So we'd love to explore that more. We do have some cost modeling from researchers in Flint to bring this to impacted zip codes in our South Bay communities. And a secondary question, what happens in 10 years?
That's great. Anyone take that? Well, thank you for that. And we'd love to see a little bit more of the modeling as well. So Courtney, I think you have my email or June's, and so we can connect from there. Oh, please.
Thank you for your input. We actually have an educational program that we started through a foundation that I co-funded with a partner based in Europe. The reason why it's in Europe, because obviously microplastics is a global issue. The foundation is called Ecomente, and it is involving high school students that are implicated into fieldwork We take them to the Arctic to collect samples of microplastics over there, to Mexico, or they come here in San Diego, or take them to Ghana, because I think the point that you seem to align is that we have to change mindset. We have to change how people think, and the next generation is to think differently than we do. And so because of that, it's a matter of exposure. I think that I brought some of the students from Ghana who lived on a beach where you have 3 feet of plastic, and for them it was normal. And they came to the beach in La Jolla, and they were literally scared to walk on the plastic, on the sand. This is not plastic, it's weird. And so this education on what is the perspective, I think, is critical. And so there is a basis for that. I'd like to, continue this discussion with you and your organization, and see if we can work together, obviously.
Yeah, and I can connect you both
Thank
as
you.
well. Yep.
Hi, my name is Abilene, and I work with the Rural Community Assistance Corporation, which is the contract holder with the State Water Board for the Tijuana River Trash Booms project, which was mentioned earlier in the presentation. And this storm season has intercepted 1,500 tons of trash and debris of cross-border flow. We're coming to the end of our pilot project season of two storm seasons, and we're definitely looking to keep it in place for as long as possible. Unfortunately, there's not much of an appetite from the current federal administration to keeping the trash boom on our side, but nevertheless, we're advocating for that to remain. Just want to confirm or suggest that the funds are also available for ongoing O&M as well as new projects and development. So just wanted to share that as a comment as well. And then also discuss the TA side of things. I work with rural and tribal communities, disadvantaged communities primarily, and it's a really common concern is that there's these dollar amounts on the table for PFAS or emerging contaminants, but they lack the capacity to kind of develop the project and get the project off the ground. So that's where TA is really important. So just wanted to advocate for a robust TA program. I'm not sure if there's going to be an RFP released for TA providers. I know our CAC would be interested in applying, but also wanted to ensure that being a TA provider wouldn't also preclude us from being a recipient of the funds for the Trash Booms project, as we remain the contract holder for the time being. So just wanted to share those two comments on O&M and the TA program.
Yeah, thank you for that, Abilene. And we are looking under every couch cushion for that state-funded trash boom as well.
Thank you. Thanks. Hi, everybody. My name is Mitzi Mayer, and I'm a documentary filmmaker, independent, and I've spent the last 6 years literally traveling around the world to focus on plastic pollution, meeting with chemists, scientists, doctors, researchers, been out on Charlie Moore's boat. It's been an amazing ride, a ride that I wish I could tell you isn't doom and gloom, but there is a lot of it. And I don't think we can sugarcoat that. And I love what you're doing. You have to bring people together and communities together. And the categories, the 7 categories or pillars you talked about, I check everyone off. I'm like, yes, 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 got to do all of that, right? But when I listen to $5 billion fund for 10 years, that's wonderful. Let's use every penny of it in the right way, because we are spending $2.5 trillion is being spent annually in economic damage for what's happening to our planet. And when I say planet, the animals, the people, all of it. And it's very disheartening. But the one thing that always comes back to me, and I guess because I'm a filmmaker and I'm very visual, I have to do this because hopefully it'll make my point. As I just scan this simple room, all of us are here for the exact same reasons, maybe different specifics of something, but at the end of the day, it's all connected. And our kids, their kids, those next generations, they're already paying for it, And so I look around. Am I allowed to touch this bottle? I don't want to touch anybody's private stuff. But I see this, which is, kind of unnecessary. And again, this is the visual in me. The recycling can is lined with a plastic bag. And every time you drive down every highway, Highway 5, doesn't matter where you're at in this country, the people picking up the trash on the side of the roads, picking up the big stuff, not the microplastics. That's the really scary part of the conversation. Every person picking up trash is putting trash in a new bag that has been made by an industry that has created this problem. It's not us individuals that have created the problem. It's an industry, and it is beyond systemic. I've been to Cancer Alley. You've never heard of it. It's horrific. Okay, I grew up in LA, surrounded by refineries, and that's kind of what got me going on all of this, realizing why were so many people sick when I was growing up? And that's where my documentary takes you on that journey with me. It's very educational. I'm not here to tout my film, but I will, because it's coming out. It's in the festival circuits now, and then it's going to just be plowed into educational circuit for free. It will not a penny. If you want to donate to your favorite organization, do that. But my point is, I also do volunteer work in East County, and primarily with young girls. I do a lot of mentoring. And I watch what they eat for lunch, what's given to them in their cafeteria. I watch if they're low income, they can take a take-home bag for free. No one's looking. It's just to make sure they get a meal at night. Plastic in plastic and plastic and plastic and plastic. We have to start simple. I want to change the world just like all of you want to change the world, but we're not even doing it in our own classrooms right here. We're not doing it in an organization where you've invited people to, let's get on this bandwagon together. And so, it sounds really simplistic, but often, well, the science is great and we need the health and we need the studies, and I believe in all that because I do believe in science. I won't get into politics, okay? But we need all of that. But we're not doing our job as communities. I've been to Africa. I've been to Asia. I've been to Haiti. I've been to, you name the places that are not pretty on a lot of levels. People are pretty and beautiful, but what's happening there isn't. And I say this and I get very emotional because I do care. I really care. And I just want us to not get hung up on, we got this what's the number again? $5 billion to spend, which, hey, to me, I could change the world with that. We all could, right? But I don't want us to get hung up on, let's do groundwork too. And we are the ground. We are the ground right here. So, I don't know that I have a question. It's more of a comment. It's observation. Thank all of you. But I get tired. And I think we're all tired because of the world, but, tired in the sense that not too tired that I wouldn't show up here, but too tired that we're not doing the little things that can make a difference. Because when the kids see me drinking out of a plastic bottle, or they see me lining my thing with plastic, why wouldn't they do it? Why shouldn't they do it? What we see, it's leading by example. So I've talked way long enough, but I just don't want us to get hung up on all the bureaucracy of so many things, and then nothing gets done. And we're creating a machine that can't clean up all the microplastics, and it can't do this, but we can do the basics.
Thank you so much.
Thank you.
Yeah, and thank you for that. And we'll look for your film. A plug, what is the name of the film?
Plastic's Hidden Path, My Journey to Uncover the Truth About Plastic.
Thank you.
Hey, thanks so much for putting this together. My name's Tim Perry. I'm here with a nonprofit called Clear Blue Sea, and we're working on a open source surface vessel that any community can build to basically collect data and trash and kind of contribute to a community understanding of that. My one suggestion would be if you guys could put together a guideline of the types of pollution and debris that you're specifically focused on, areas where you could use more data. I think that could really inform some of the sensors that we would like to put on this, but also if you could put together some guidelines on the data format, making sure that we're all contributing, the same type of reporting that can be ingested by anybody through this whole network of all these organizations, and make sure we're understanding the same thing from that. That would be really, really helpful just in developing these solutions. So
Yeah,
thanks so
those are
much.
helpful suggestions. Thank you so much as well. And while you're walking over there, if you have not yet, please sign in and put your name before you leave and your email address so that we can stay in contact. We would love to continue conversations, but also share other opportunities as they begin to form. Please.
Yes, hi. Thank you to everyone, and thank you, Molly, for the amazing, what shall we say, speech. I work for Casa Familiar down in San Isidro on the border, and maybe many of you are familiar with our longstanding commitment to community there. And when somebody made the comment back here, I think about the rivers and the pollution clogging the rivers, and I just got this. So I do have a question, but very quickly a connection, because one of you was speaking about the public health impacts and the carotid arteries that get clogged with pollution, and I immediately made this connection. I was like, that's what's happening with our rivers. Rivers are lifeblood. Rivers are getting clogged. Our planet is getting clogged, and I say that because we have a very robust arts and culture program, and we have a place called La Frente, which has art exhibits. Our youth are very active, and lots of just amazing talent there with kids making connections visually and artistically with the pollution in San Isidro. And I was wondering if you could speak to the possibility of doing arts and education in this grant, or if there's money allocated specifically to that. I know there's an outreach and education component to this money, but what is the possibility of arts and engagement in this allocation?
I love the idea. It just sounds like something we would more than likely consider, right?
Yeah, it does sound like a good idea. What we're looking is for effective activities, right? And so if the most effective way to help kids and youth understand the impacts of plastics and their future and use of plastics, and that is arts, then that is something, we could look into.
If I can make a comment on this as well. In the fall at UCSD, we are having a microplastic art exhibit. So, feel free to check the UCSD website. It's going to be sometime in October or November, or I will announce that through this platform here. But it is exactly for that purpose. Unfortunately, microplastics can be looking very pretty under the microscope. It's fascinating. It makes beautiful pieces of art, but it is also, mind-blowing that you can actually see them and then realize that these might be in your body, in your brain, in your lungs. And by this power of images, that's why we are trying to bring this concept to art lovers or kids from schools.
Great. I saw another hand up.
Yes, hi. I'm Ann Middleton. I'm also with Costa Salvaje Wild Coast. Very briefly, I don't think you probably have a lot of control over this, but please, we all beg you, if there's any way you can reduce the administrative burden of applying for this funding, that would be so much appreciated. I know we're all applying for Prop 4 money, and we went through the IRA funds nightmare, and it's a lot of work and takes a lot of our organizational funds and capacity to apply for this money. So anything you can do to make it simpler would be very, very, very much appreciated, including events like this. So thank you.
Thank you. That's helpful. And I believe the Prop 4 money solicitation opens in the next couple of days.
All right.
So some good news.
And I'm Chris Helmer with the City of Imperial Beach, and it's great to have CalEPA here. And it's very appropriate that we're meeting the Water Board because it was back in 2008 that the Water Board started the Tijuana River Valley Recovery Team. And at that time, the big issue was trash and sediment, because those trash and sediment, you can see just through like LiDAR data how much that was just transforming and changing the hydrology in the river valley. And the recovery team started a recovery strategy, has 27 projects, still very relevant today. The recovery team still led and coordinated, quarterly, sometimes monthly meetings by the Water Board. So I would encourage you guys to leverage the work that's happening in this building as well, and use that as really a foundation to jumpstart some of the projects that we've thought about for many, many years. And then we obviously have decades of data of the volume of trash in the river valley. So hope that's some good help.
Yeah, thank you for that, Chris. And we're having conversations at the statewide level with the State Water Board, but we're asking them to also reach out to the regional boards and have discussions as well. I see one more hand here, and I know I also want to try to get to at least a couple of people online. Go ahead.
Sorry, I'll be quick so you can get to the folks online, but I'm Kristen Goodrich. I'm with the Tijuana River National Estuarine Research Reserve. Thank you so much for this conversation and this constellation of folks in the room. We need everybody to be working on this issue. In the spirit of that, in 2023 and 2025, we, along with California Sea Grant and also our community partner, Un Mar de Colores, brought together a Marine Debris Leadership Academy that crossed the border, but also brought in multinational partnership from the Kumeyaay Nation, US and Mexico, to try to support the leaders who've been doing this work in the region. Just recently, within the last 6 months, we came together to form a coalition, now with over 100 individuals from each of those nations. And I guess I'm sharing that because there's already an amazing kind of undercurrent of leadership in this area. And I was curious if you could maybe just speak briefly to the technical assistance dimension that you shared. I saw technical assistance, as you listed, was for maybe like grant writing, but I'm also wondering what other ideas you might have for supporting already this coalition of leaders who are actively working across borders and nations on marine debris issues. And also, might we be able to apply as an organization to be able to continue to provide different kinds of technical assistance to these folks? So,
great question. What's the name of the organization that's formed again?
it's called the Marine Debris Leadership Coalition. And the conveners are the Tijuana River National Estuarine Research Reserve, California Sea Grant, who's the funder of our academies that led to the coalition, and our community partner is Un Mar de Colores. But it involves over 100 organizations and individuals of those organizations who've been actively coming together to find solutions that span borders through their leadership.
Yeah, thank you for that. Anybody want to respond to?
Yeah, I can just say that your suggestion, I think I've seen it come up in other spaces as well. When we, yeah, you're right that when we've been generally speaking about technical assistance, it's thinking about those percentages in the mandate that we have to reach disadvantaged communities and other communities that may not be so well resourced to usually apply for grants and those sorts of things. And so what the state of California has done, I think, very effectively over a number of years is provide assistance to those organizations so that they can put, their ideas on paper in the best way possible, right? But I have also heard about technical assistance that's more topical to plastics, right? And microplastics and other ways in which plastics are impacting our community. So I think that's a note we're taking, and we'll certainly consider that.
Yeah, if I can just add really quickly, is that if there are ideas that you feel like we should be incorporating in the technical assistance model, please use the survey at the CalEPA Plastic Pollution Mitigation website. That is a great tool to get your ideas put on record. And we're always going to be soliciting feedback from that as well. So thank you. Okay, I think we have enough time for about one question. So if you are online and you are interested in asking a question, please use the raise hand feature, and then you will be unmuted. Please say your name and organization if you are with an organization. And again, if you are here, please sign in, include your emails, because there's a lot of great information here, and we want to stay connected. June, do we have any hands raised online?
We do. We have 3 so far. The first is from Ramon Cherez. Ramon, you can go ahead and ask your question.
Hi, good afternoon. Can you hear me?
Yes, we can.
Thank you. Thank you so much for this the presentations, the visit, and the conversation. I'm representing Four Walls International. We're a nonprofit that's been doing work in the Tijuana River Valley at some of the source-based areas on the Tijuana side, but also on the American side as well. And so my question is this, given the scale and duration of the Plastic Pollution Mitigation Fund and the well-documented role of transboundary plastic flows from the Tijuana River in driving pollution impacts, our question is this, will the roundtable discussions and engagement processes leading up to the agency's investment recommendations include binational local government waste management departments and private sector recycling operators? Another way to frame that question is, will the conversation be focused on the informal recycling sector, binational supply chain dynamics, and the EPR and materials standards gap that currently focuses on captured border plastics into landfills rather than circular markets?
That's EPR, right? Yeah. Yeah, I think some of that would fall under the EPR as well. So the producer responsibility organization may cover some of that. And I wish we were able to have them here, but they're not here. So the Circular Action Alliance is leading the response for the PRO. Is there another question, June?
Yep. The next question comes from Michael One-Seidler. Michael, you can go ahead and ask your question.
Terrific. Thank you, everyone. So pleased to be here with you today. My name is Michael Wetzel. I work for the County of San Diego and the Solid Waste Planning and Recycling Program. I found the discussions today from the presenters as well as the attendees really informative and valuable. We heard initially from the researchers regarding the concerns of ingesting plastics and that funding would be able to support communities in reducing their plastic use. I'm curious to hear about funding activities and workshops to help people specifically reduce their use of plastic. So those activities that could be taken on a personal level to reduce that waste as well as a community level. As one example, there's been some really neat programs both locally and nationally by Ocean Friendly Restaurants, by Surfrider, and Rethink Disposables that allow restaurants to either promote the fact that they're using reusable food serviceware, and some others that actually help them transition to move from single-use plastics to reusable foodware for their dine-in customers. So I'm curious to hear if that may be an option for funding. And then before I close, I also want to just promote, since we're talking about reducing waste, I want to encourage those that live, work, or are connected somehow to the unincorporated areas of the county. We are working on identifying new programs and policies to help us reduce our waste just this week and next. And we're having community meetings to discuss that and encourage you to, those that are interested, to participate in our meetings. We'll have some virtually, and you can find those through social media or Googling the County of San Diego's Engage page and strategic plan to reduce waste and learn more there. And with that, I'll take my comments with my mute off. Thank you.
Thank you, Michael, and we appreciate the county's efforts as well. I know we're a little bit over. Can we do one more question? Everybody okay with that? One more question online?
Last question comes from Ellie Honan. Ellie, you can ask your question now.
Hi, thank you for taking my question. I'm with the Resource Conservation District of Greater San Diego County. We provide technical assistance and programming for agricultural producers in San Diego County. Thank you for the extremely comprehensive presentation. When looking at ways that plastic impacts our water, soils, and air, and is in most of the food we consume, I think this creates a really important opportunity for engagement with the agricultural community. So I'd love to hear what that potential looks like. I think engaging agricultural producers is both an opportunity to explore ways of producing healthier, cleaner food and exploring bioremediation, but also reducing plastic use on farms. The agricultural industry is unfortunately highly dependent on plastic materials for food production. Ironically, the most efficient way to apply water involves plastic disposable drip irrigation. And so exploring ways to both reduce plastic use, but there are also options that could be better integrated into the recycling some of that plastic. There are examples in Northern California, specifically San Mateo, of agricultural operations actually recycling and reusing drip irrigation. And so I think exploring those opportunities could also significantly reduce the plastic that's moving from agricultural operations into the landfill. And I think there's also significant opportunity for education and technical assistance and research in the agricultural sector as well. So I'm curious if the agricultural sector could be an area of funding and what that might look like.
Thank you for the comment. Yes, and question. Yes, plastics in agriculture is certainly a concept we're exploring. How that's going to look, we're still working on those concepts, but and collecting information from these community events. So thank you for bringing that to light into our attention. I do know that the Department of Pesticide Regulation does run a recycling program for HDPE used in the industry. I don't know. I don't have a ton of other specifics, but worth exploring as well.
Thank you for that. And that will be our last comment and question. I apologize to everybody who stayed a little bit longer, and especially to the folks online who may have additional questions. I do want to point to the CalEPA Plastic Pollution Mitigation Fund website. There, the survey is available, so your comments and questions can still carry on beyond this conversation and can be implemented through our survey. So please go to the CalEPA website. If just for ease, I just go CalEPA, Google CalEPA PPMF. Just for ease, and it'll pop right up. And then please scroll down. There's FAQs there. There are ongoing engagements there. In addition to that, our survey is also there. So plenty of opportunity to continue to engage as your brain starts to think and you start interacting with the world again and saying, oh, we need to do something with this. There's an opportunity to then reflect those ideas through that survey and through future engagement opportunities. With that, I would like to thank our professors and doctors at UCSD, Dr. Abeles and Dimitri as well. We really appreciate your leadership, the comprehensive and interdisciplinary approach in thinking around plastics. And thank you to my colleagues from Sacramento who made the long trek down here to be with you all as well to share a little bit more about this fund. And thank you all for your interest. And we look forward to continuing this partnership with you as we move through this process and this timeline. Thank you again.